Cholesterol-lowering drugs called statins hit the market in 1984, and yet every year heart disease continues to rise. Russ Scala of Scala Precision Health started the Institute of Nutritional Medicine and Cardiovascular Research to investigate why this is happening. He joins us on the show today to share some of his groundbreaking findings. Russ, welcome, and thank you for joining us.
How are you?
I'm wonderful. I'm really looking forward to diving into this. I apologize in advance because I'm going to be firing questions at you.
That's good. Bring it.
Yeah, well, okay, I'll start off just me. As a woman myself, I hear time and time again about the dangers of breast cancer. You know, women, we got to, examine ourselves. We got to do all these things. But the leading cause of death in the U.S. for women, statistically, is actually heart disease.
Right.
Now, why is it that what we hear is so much about the breast cancer, the other things, and not this heart disease for women?
Well, I think it's slick marketing. They market breast cancer, which, we help people. We've got breast cancer patients in remission. We have a cancer protocol for breast cancer patients. But you're right. The number one area that kills women is heart disease. And even back when I was a paramedic, women don't have any signs of heart disease. Men would have a pain in their shoulder, abdominal pain, jaw pain. Women would just have a heart attack. Yeah. So cardiologists out there treat women like little men. We need a heart disease program specifically dialed in to women that focuses on women's biochemistry, women's hormonal levels, women's diet. We need a heart disease program that specifically focuses on women, and that isn't what's being done. If you were a heart patient, if you had problems with your arteries, you went to a doctor, he would treat you today, cardiologist. I'm consulting 3 of them right now. He's going to treat you like everybody else. So I'm trying to implement these programs into cardiologists' office that have 3,000 patients so they can start doing it the right way. And then I'm empowering the women to ask the tough questions. Don't just throw your hands in the air. Don't just think it's cholesterol, take a statin drug. You got to understand
take control of your health.
A little bit. You understand a little biochemistry. All I'm saying is understand a little bit about your metabolism, and you can take control of your health and avoid heart disease. Like I said, women are on the back burner with this stuff, and we need to change that.
And just a moment ago, you mentioned when you were a paramedic.
Right.
If you could just kind of go back for us and give us a little more backstory of your background, because I know you're extremely qualified to be here discussing this, but if you could just share kind of what got you to this place.
Okay, so heart disease, luckily I worked in the emergency room through high school, and I was fascinated when they would bring a heart attack patient in, and they would be surrounded by the respiratory therapeutic doctor, and I'd watch them start a guy's heart and bring it back to life. I was like,
fascinating.
It was the most fascinating thing I've ever seen. Guy was dead when he came in atrial fibrillation or ventricle fibrillation.
A real life Lazarus.
Yeah, and they would give him the drugs, the adrenaline, they would shock him, and he would come back to life and he would wake up. I knew then at 14, 15 years old, this is what I wanted to do. So let's fast forward. I went to paramedic school with the doctor's advice. I hit the streets. I started running on cardiac arrest patients. I started doing the same thing. People would die in my arms. People would come back to life, and I was always asking a lot of questions. I was fascinated with heart disease, and the doctors at the time just thought it was cholesterol. Like, why the coronary arteries becoming blocked? And they, across the board, they would say it was cholesterol, and I knew it was something else. I became a triathlete in '96. I started studying why triathletes were having heart attacks, which blew me away. I would go away to these races and see these extremely fit people, friends of mine, that I knew had great hearts, great collateral circulation. They were having heart attacks, and
it's
they
like
had
a clear juxtaposition that's going on.
Right, and they had normal cholesterol. So you got that. My history as a paramedic, responding to cardiac arrest, seeing as a triathlete, endurance athletes, and bodybuilders having heart disease. And then I worked with a venture capital company that hired me and wanted me to go to the best cardiovascular research labs in the country to meet with the PhDs, the physiologists, and the cardiologists. And that's when I knew. I go, there's a paradigm shift coming, and they got it wrong. So I would give presentations to cardiologists, and they just couldn't wrap their head around it. That was like in '96. So now I know. I've worked with heart patients. I work with cardiologists, everybody from high calcium to stents. I've worked with transplant patients. There's a whole paradigm shift coming, and it's huge. And again, you got to drip the science on people slowly. You can't just treat, treat heart disease with the cholesterol-lowering drugs. You've got to look at endothelial dysfunction, which we talked about before.
Right. Now, as someone, you have researched heart disease, quite frankly, your whole life. And I can't imagine how frustrating it must be to see how slow it is for new research to be implemented, and how challenging and difficult just that constant pushback when you have this information, you have this research, and you know that this is, something that can help save people. How do you, why is that the case?
Well, anytime you are on the tip of the spear doing advanced work, people are going to shoot you down. You ever hear of Dr. Semmelweis? Dr. Semmelweis was a doctor like in the 1700s. He was the first doctor to know that, he was the first doctor that came up with, you had to wash your hands before you went into surgery.
Okay.
So doctors were leaving the autopsy room and they were coming into surgery and the people were dying of infection. So at the time, Dr. Semmelweis said, you have to wash your hands. He was run out of medicine. They vilified him. They ended up locking him up in a mental institution.
Oh my gosh.
So here we go. It's like saying everything, who was the astrologer that said everything rotates around the earth. So again, I'm trying to give examples. This is all new information. You got 30,000 cardiologists in the United States that think heart disease is caused by high cholesterol. That is not true. This is all changing in real time. So the people, the individual influencers are getting on YouTube and telling their story.
Absolutely.
Powerful. People are running their own lab work, like we just talked about in the last video. Running their own lab work. They're doing, instead of doing cholesterol testing, they're doing lipid particle testing, which is the labs that I travel to. So it's the individual influence. It's getting away from mainstream media, and it's the people that are on social media, people that are the individual influencers, whether they're on X or they're on some type of social media platform, telling their story. The only thing, when I have somebody that I'm trying to educate, I try to customize a treatment protocol for where they are. So I do a lot of therapeutic listening. Where are you in your life? What do you do? Then we do the lab work, and then we find out what his physician is recommending, and we take all that research, we give it back to the patient, we educate them. Sometimes their doctors want to play ball. Sometimes we got to find them another physician to work with them. But
it can't just be a copy paste.
No. It's everybody's biochemically unique, or everybody has a story. And stress levels, we studied war veterans, and we know that elevated glucose, low testosterone in both men and women, low thyroid levels. Like if you take the thyroid gland out of mice, cats, dogs, and horses, they'll end up with heart disease. So really, it's multiple metabolic systems of your body that damage the lining of your artery, and that information is out there. It's called the endothelial lining, and nitric oxide is going to be the future. Nitric oxide is what the arteries release to stay dilated. So this is kind of a long word, but there's a test we could do to test nitric oxide. It's called asymmetric dimethylarginine. Now, I don't expect anybody to remember that. Well, I'm not going to expect anybody to remember that, but we could actually test nitric oxide levels.
Wow.
And when you balance out somebody's hormone levels and testosterone and thyroid, and you get them on the right nutrition, those arteries release nitric oxide and keep the arteries dilated so more blood gets to the heart. So, and think about this, for a true longevity program, this is mind-blowing. Think about all the organs in your body.
Right.
Arteries have to go to those organs and feed it oxygen. So if your arteries are dilated and all your arteries in your body are releasing nitric oxide, the multiple organ systems in your body are all going to function better, not just your heart. So I don't want to function on your heart. How's your liver doing? How's your brain doing? All have arteries, and those arteries are the highways that we want to maintain, and we don't want them to get blocked. So nitric oxide, I've got a really good friend of mine, Beth Shirley. She's a pharmacist that came up with a nitric oxide supplement. She's brilliant. And these supplements are available, and these people are part of our team that, I'm not saying everybody has low nitric oxide, but as we age and our hormonal levels go down and we're nutrient deficient, our arteries don't respond as well. And when that happens, calcium builds up on the heart.
Right.
Okay, and soft plaque rupture, a little blister can form.
Oof.
A little blister can form, and that blister can pop. Well, now there's imaging we can do. There's one company out there called Clearly, Cleery, that could actually measure not only the hard plaque, but they could measure the soft plaque right now, which is really allowing us to peer inside the heart in real time and make some definite movements. I'm glad to be involved in it right now. I know it's a slow process. Like I said, I was an endurance athlete. I'm not in a rush. I get it, and I get it. So when you have all these things that are happening, And, you know, I always say, sometimes I feel like, you know, I saw Bigfoot Jackie Kennedy in a UFO and my camera jams. I'm like, damn it. You know what I mean? And everybody's going, well, show us proof. And I'm like,
yeah. So you just got to be a little more patient, right?
yeah, exactly. And and the people that I work with, the clients that I work with, God, they're brilliant. I mean, I listen to everything they do and everything they say. I'm always astounded by people that really dive into their health and make a difference.
I'm astounded by you.
What's that?
I'm astounded by you.
Yeah, I just been doing it a long time, and I stepped on a lot of landmines and made a lot of mistakes. I mean, when I was a triathlete, I was damaging my heart, but you know, since I had a tan and I had a low resting heart rate, thought I was healthy. And I'm racing all over the United States. I was killing myself, you know, because my group, you know, I was hanging out with a group. My need for affiliation, all triathletes, all doing the same thing. I was eating a high carb diet. Totally wrong.
It's scary to think that you could be doing something that you genuinely believe in your heart is good for you, and yet you're actually, you know, hurting your health, you're hurting your heart, you're causing more heart disease, especially as a woman. Some of those stats you were sharing earlier, that it is a leading cause of death, and yet it's so under-researched, rather.
Right.
So what can women such as myself do, you know, today? How can we start making that small step to make a change?
Yeah, first of all, you want to educate yourself. I've got videos on the Russ Scala YouTube channel that talk about estrogen dominance. If a woman has high estrogen and low testosterone and low progesterone, low thyroid, which happens as we age, okay, it damages the endothelial lining. So if a woman just got her hormone levels and fixed those deficiencies, way ahead of the game. Now the problem she'll run into, she'll go, Doc, I want to get my hormone levels checked. He goes, well, why do you want to do that? And this is the pushback.
Pushing back.
Yeah, it's like just test the hormones. I mean, you work for me. It's so frustrating. And then when that doesn't happen, they get online and they call Quest, or they pay for it themselves, and they get their hormonal levels testing. I work with a lot of financial advisors that are always talking about, you know, Russ, you should save money, your 401k, but none of these guys talk about health. A lot of people retire, they got a lot of money in the bank, and they took so many hits in the chest, they're unhealthy. Now, a good financial advisor will tell them to get on a wellness program. I'm working with some right now, and they can't seem to wrap their heads around it. You know what I mean? It's just like, you know, great, I got a lot of money. I got $2 million in the bank. Great. Now I've got diabetes, heart disease, and I'm on my way to cancer. Rock on.
Let's talk about guys as well, because I don't want to leave out our male viewers. What can they do?
No, the guys can do the same thing. Get their hormonal levels checked.
It's the same.
Yeah, it's the same thing. And like I said, men can go on the Russ Scala YouTube channel, and they could look up testosterone and heart disease. For men, the right balance of testosterone, estrogen, progesterone, thyroid, and their gut microbiome all impact their heart. Remember, this is another thing. We always compartmentalize everything. Every system of your body is interconnected and talks to each other. Cellular crosstalk.
Amazing.
I don't want to put you to sleep.
Amazing.
But
Never.
what I'm saying, your heart produces hormones. I mean, think about this. Today, your heart will beat about 80 to 100,000 times a day. Amazing, right?
Amazing.
It starts beating when you're inside your mom and lasts all the way to your 90-something years old.
Yeah.
That pump works better than any Mercedes pump out there.
Perspective.
Right? I'm just saying. So
Powerful.
what? So don't you want to protect that heart? And I'm not trying to say, you know, I'm not trying to be all I'm saying is, if the red light goes on in your car, you take it really immediately to a mechanic.
So why wouldn't we do that for ourselves?
Yeah, if you're gaining a little weight and you're not losing weight, then it's time to make a move, right? And the thing, there's a lot of bad information out there that confuse people. So I always say people have been hoodwinked, lied to, and bamboozled by the traditional medicine, by, you know, nutritionalists, and people are confused and are upset, and you wonder why they want to go use Ozempic. It's like, nothing works for me. They start blaming themselves.
Yeah.
When intermittent fasting, the ketogenic diet is changing the way we start to think about life and extending people's lifetimes. You know?
Your number one piece of advice for anyone watching, regardless of gender, is to check hormones.
Yeah, check your nutrition and hormonal levels, and I can show you how to do that in a 5-minute phone call.
Yes, Russ Scala Precision Health, very wonderful. Now, I want to go into a bit more of these blood tests, you know, not just hormone level. What kind of tests specifically should we be requesting when we're going and asking for these things?
A basic panel is, you know, for men and women, and you could Google this as well, getting a hormonal panel. There's 3 different estrogens in a woman's body: estradiol, estrone, and estriol. So she wants to get her estradiol checked, her progesterone levels, her thyroid TSH, T3 and T4. You want to get your hemoglobin A1C to see how much sugar hits your red blood cell in 90 days. And you want to get your fasting insulin. I mean, that right there will give us a wealth of knowledge. Now, you want to check your microbiome, your gut, which is the second brain, because you're not what you eat, you already absorb. That could come later.
Yeah.
We can tweak the diet, but getting your hormone levels, getting your nutritional levels, everybody's talking about take this individual supplement. You know, here's the deal. You clean your gut up. All synthetic vitamins don't have the same cofactor as food. Food in China is considered a functional food. Food has the cofactors and the vitamins that synthetic vitamins don't have. So if you clean your gut up and you're pulling more nutrients out of food, doesn't that make sense? Absolutely. Yeah, so you remove the processed food from your diet, and I know it's very addicting. The same PhDs that work for big tobacco now work for the food industry. And they take salt, fat, and sugar, and they manipulate it where it crosses our blood-brain barrier and makes us have cravings. It's not the people's fault. So just by understanding that and understanding how to shift your diet and have a coach that will walk you through the process, you're going to be in a better place.
Absolutely.
Yeah.
Wow. Now, you've been doing this just about your entire life, as we've talked about many times, and you've influenced countless people with your research, with your knowledge, your information. So you do have a fiercely loyal fan base. So I want to ask who you're a fan of. Who are the influencers that you follow and why?
Well, listen, anybody that's out on the tip of the spear, you know, whether it's Gary Brecka or Peter Attia or Dr. Benjamin Bickman, all these guys, I love all these guys. They all bring a little something to the table. But one of the things we got to remember, no matter what influencer you're listening to, look at their backstory. Where did they come from? You read my backstory, you know I've been doing this 40 years.
Yeah.
You know, I pushed myself as a triathlete. I've had people die in my arms. I've trained physicians, and I work for compounding pharmacies. So that's my history. Am I better than anybody else? No, I keep asking questions. Some of the influencers that are pushing individual supplements, some influencers that are just saying, do this one protocol. Everybody's biochemically unique. Everybody has a story. There isn't one size fits all. But the influencers are a lot better than mainstream media, right? Listen to the influencers that have had cancer that were told they were going to die in 6 months and they're still here. There's a lot of them out there, all right?
We'll have to dive into that one.
Yeah, no,
I find that so
spontaneous remission. We're going to talk about that. Yeah, I can't wait to do that one with you. Yeah.
Wow. Russ, you are just a powerhouse of life-saving information. I can't thank you enough for joining us.
That was fun.
Always a pleasure to have you. Thank you.
Yeah, thanks.
Absolutely. For more information on Scala Precision Health, you can head over to scalaprecisionhealth.com and the Russ Scala YouTube channel, where you will find a wealth of free knowledge that awaits you. Thank you for watching.